Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Waldo Floyd III. He's a board-certified orthopedic surgeon, and he also holds a special qualification in surgery of the hand and is fellowship-trained in hand surgery. And today we're going to talk about his practice here in Central Georgia. Dr. Floyd, thanks so much for being with me.
It's wonderful to be here. Thank you.
Would you tell me first, why did you pick hand surgery? Of all the things coming out of orthopedics,
Well, out of medicine, actually. Well, I'll tell you that my father was a hand surgeon and was one of the first hand surgeons in Georgia. And I was actually very interested in all aspects of surgery, particularly cardiothoracic surgery. And I was down here at this hospital at what was then the medical center, assisting in heart surgery when I was in medical school with Dr. Shaker and Dr. Friant, who founded the cardiac surgical program here. And it was fun, it was great, but one of the surgeons, Dr. Ellis Evans, he came up to me and said, basically indicated that I might have a longer career and may be happier if I operated on hands where you're dealing with quality of life rather than length of life, and you could do your surgery sitting down. So I don't know if my dad put him up to it or not, but I took what he said to heart, and then as well as that, hand surgery was developing as a field. A lot of over the past decade before that, a lot of replantation, a lot of microvascular surgery, a lot of innovative free tissue transfer, such as toe transfer to thumbs, and was being done. And hand surgery was really just sort of maturing at that time, and I thought I'd jump into it.
And what is it about the hand? I mean, you talked a little bit with me earlier about the artistic side of it and the idea of what is it about the hand that maybe attracted you? Again, the complexity, the fact it is a system.
Well, yes, it's a system. It's how we manipulate our environment. And also, in current civilization, the face and the hands are the only thing that's always exposed. And I enjoyed the reconstructive aspects, I enjoyed the artistic aspects, and you could really help people. And at that time it was, there weren't many hand surgeons. My dad was here, but he didn't really do microvascular surgery. When I came back home, I grew up here in Macon, so I really wanted to come home, and there was talk about staying in Boston where there were 30 hand surgeons at that time, and when I came to Macon in 1987, I was the only hand microvascular surgeon between Atlanta and Gainesville, Florida. So that's sort of, and that's one of the things that has made this medical center a great, attraction, a beacon for healthcare, because there's such a teardrop of a patient catchment area, as we call it, from Atlanta down to the Florida border. And back then there were no hand surgeons in Savannah, none in Columbus, and so it was sort of it was actually like moving to the hand surgery frontier, so to speak. But at the same time, had a world-class medical center, and one of the things that had brought my dad here when he moved here in 1961 was the high quality of care for surgical patients. At that time, I'm fairly certain I'm right, there was not a high level of anesthesiology in, say, Savannah or a lot of other towns around the state, and there was very contemporary anesthesia care and medical care here, so that when you're taking care of surgical patients, you want them to get through the surgery. So a surgeon needs that support system, as their patients do.
Well, you talked a little bit about quality of life. What is your interaction with patients? Hands are so fundamental to civilization and work, and what is that like for you when you're facing the challenge with the patient? How do you frame that for them in what you can restore to their function?
Well, right. One, I see a lot of patients, and you cannot take care of hands without touching the patient. You have to examine the hand, and the hand's a very personal thing, and so there's immediately a bonding just in that type of caring and evaluation. And then there's so many different things that can be wrong with a hand, from burn victims who've lost their fingers to adults with carpal tunnel syndrome whose hand goes numb when they sleep, and various types of arthritis, and some things are related to paralysis and restoration of paralyzed limbs. In fact, one of the things about Georgia and paralysis was with polio and the Warm Springs Institute and FDR's influence there in the 40s. A lot of the early work in tendon transfers was done in this state.
What, when you talk about returning people to function, tell me about that conversation. Like you said, there can be so many things that are wrong with people's hand. Is there a lot of this managing the expectation of functionality, especially with something that,
Well, the thing about operations, you don't want to, because I'm a surgeon, I mean, I do a lot of non-operative care, and I try to reserve surgery for when we've proven that it's absolutely necessary. But, all procedures you're not going to make something as good as God made it. So everything is short of 100% perfect, but you have to describe the reasonable expectations for a lot of procedures. I'll say this procedure has an 80 or 90% chance of making you 80 to 90% better. There are some situations, though, where if someone comes in with nothing, a little is a lot. And so if you have a patient who's lost all their fingers, and there are things you can do to restore, pinch, or grip, or give them some rudimentary functions where they can feed themselves and take care of their activities of daily living, you've done a lot. So it really depends upon the patient. Some patients just have real bad tendonitis and pain, and there are various things you can do where the chief goal is pain relief. A lot of what we do, particularly with arthritis surgery and tendon surgery, is to try to relieve pain.
When you look at all the technology that you've seen change over your career, what's the thing that you're most excited about now that either you currently do or you see coming in the next decade when it comes to hand surgery? Well,
the most exciting sort of way out there type thing, but it's being done, is the potential for allograft transfers, which means if you've lost your thumb, ultimately you get a cadaver thumb, or a freshly, just like we harvest hearts and livers and so forth. And there is that being done in the country now, particularly hand transplants are being done. They're not as, they're a long way from perfect, and you're putting a patient on a lifetime of immunosuppression. So if someone has one hand and missing one hand, you probably wouldn't do it. You'd probably want the situation to be sufficiently desperate that that one hand and then maybe another would make a big difference. There are a lot of endoscopic procedures that have come to the fore that have been developed during my career and will become more refined. There are multiple treatments just for a common wrist fracture that many of us get when we get older and have osteopenia and so forth. There are huge advances have been made in the care of wrist fractures. In fact, that's why I came in a little late today. I was taking care of someone who had sustained one last night. But and then there are, you know, a lot of things we do are resurrecting things that have been done before, but making them more refined and improved. And really there was a huge, and I alluded to it earlier, there was a huge revolution, exponential growth in hand surgery. Well, it started as a specialty after the Second World War, but by the 1975, well into the early years of the 21st century, new operations were being developed, you know, every time you opened up a journal.
What would you say to the next generation of hand surgeons? What you decided to do it, and you've loved your career, so you're very passionate about it. What would you tell them when they come to do their fellowship and they want to talk to a seasoned hand surgeon?
Well, one thing I tell them is I have the best job in town. And the other thing I tell them is to get the best training they can get. And once they have the best training they can get, go back to a place that needs them, and then be affable, able, and available. And so you know, if you're not available, you're not helping people, and you're really not developing your practice and using what you've learned. If you're not able, you're not helping them, and if you're not affable, nobody's going to want to see you. So that's what I tell them. I tell them the 3 A's.
And if you hadn't been a hand surgeon, what would you have picked? I'd
have either been a cardiothoracic surgeon or a plastic surgeon.
So also in medicine?
Yes. Yes. I was I was a history major in college. My dad, my granddaddy, and my great-granddaddy were all medical doctors, and now my son is as well. So there are 5 generations of us, and I always knew I wanted to be, really I always knew I wanted to be a surgeon. But in college, I majored in American history because I didn't want to be just a surgeon. So I've really had I've been charmed and fortunate and blessed in that sense.
Well, thank you for telling us so much about your practice. We appreciate you.
Thank you so much.
Thank you, and thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Floyd and his practice, please visit us at atriumhealthnavicent.org.